Hi, my name is Arun. I'm the founder CEO of Mevoked. And as with any startup, people love an origin story, right? And so when we first started Mevoked, we were going after general depression. We actually partnered with the Mayo Clinic to use it with their Diamond program. So the Diamond program is probably one of the most innovative integrated care programs for mental health. When we did the study, we had amazing results, but there was too much variability in the population. You have age between 18 and 65, male and female. There was just so much going on that we weren't sure, like, we had the engagement, but was it really making that effect that we wanted to see? Around the same time, my wife and I had a baby, and she had early signs of postpartum depression. And so I put her on the solution, on the platform, to see how it would work with her, and it actually worked amazingly well. At that point, we realized that in behavioral health in general, we're not really targeting specific groups based on what they're going through. Examples of that and examples of areas that we're looking at and working in are maternal mental health, distress with diabetics. If you talk to a diabetic, people always go towards depression or mental health issues, but distress affects 4 out of 5 diabetics because it's a hard condition to manage. Also, support during chemotherapy. Most doctors don't prescribe antidepressants because they're going through a lot. Mental health support during that period is so key that these are very specific programs that can help people who are going through very specific things, and causation is not a part of our current behavioral health setup. So that led us to focus on maternal health as our first commercial product. So why? I mean, the stigma is extremely high. Everyone assumes you should be happy. Everyone assumes everything is okay. The resources are lacking. I mean, basically the resources are face-to-face therapy and websites. The best people, even doctors, refer them to Postpartum Progress, which is a website. Or sometimes you can call certain numbers. But again, those are not very helpful, especially when helping a mom pass that phase. Because in the first 6 weeks, it's usually baby blues. Beyond that is when postpartum depression, postpartum anxiety actually develops. Now, there's no... going back to that, there's a lack of technology. And we felt that using our platform, we had a really interesting way of engaging moms, but also at the same time delivering interventions in real time. Now, when you look at the numbers, there's actually 20% of all moms have some symptoms of postpartum stress, anxiety, or depression. That amounts to 800,000 moms a year, and it's, again, a recurring market. That's almost more than double the number of breast cancer patients per year. When you look at the cost, every mom that has some mental health issue, not necessarily mental health, but just symptoms, the service utilization cost actually goes up by 90%. And that actually costs hospitals $5,600 a year. And most of these are in ED visits or acute visits. So we realized that this is not just a good thing to build, but there's actually an opportunity to make a difference in behavioral health, which is so broad and so difficult to make a meaningful impact. Now, what do we do with Mevoked's technology? So Mevoked's technology is a passive platform that tracks behavior and plays the role of a concerned 24/7 care manager. If you look at most care coordinators in behavioral health programs, their job is basically calling the patient, getting them to fill PHQ-9s, and make sure they come to their visits. What we're able to do with Mevoked is basically track them, intervene in real time with actual interventions. And these are clinically validated interventions. We've partnered with Oregon Research Institute that's developed a program called Mom Mood Booster. And clinically, they've reduced depression in 90% of cases. So we're able to build that in the back end and actually deliver these interventions when moms are going through issues. So an example that I can give is, when you look at issues around breastfeeding, around connecting with baby, those are specific issues moms go through, and those are things that we can track through our platform. So where are we at? We raised seed funding from Launchpad Digital Health and the Mayo Clinic. We are revenue generating, and I need to update these numbers, but we're actually going to hit a higher number this year. And some of the partnerships and customers that we have been pretty amazing. And the great thing about the platform is we're not only able to affect moms that can afford the solution, we're able to go into the Medicaid population. And some of our partnerships with Planned Parenthood, kind of show that we're actually able to reach moms who need help or reach the population that actually needs help. Another partnership or a customer I'm very proud of is the US Army. The wives of active duty soldiers have a postpartum depression rate 3 times the normal population. So we're actually able to go in and help them manage that population, which is very difficult for them to do, especially with a lot of the issues they're going, even just providing healthcare to the soldiers. In terms of a team, my background, engineering, machine learning, and algorithms, we have 2 renowned clinicians who basically are passionate about the space. Deb is one of the top 5 in what she does. She was the ex-chief of perinatal psychiatry at UPenn. Pablo is an engineer who became a psychologist, focuses on family therapy, and we're essentially bringing a team together that doesn't just have the ability of engineering, but also the ability to understand the clinical environment and create a tool that can make a difference. With Mevoked, we feel very passionate about what we're doing, and we know that we can make a difference in behavioral health, which is, at this point, very broad and not specific enough for the people who need help. Thank you.